Welcome to the Compliance plus Ethics equals Integrity podcast, featuring BerryDunn healthcare professionals and expert guests discussing their insights into contemporary as well as perennial healthcare regulatory, revenue integrity, general compliance, and risk management topics. My name is Robyn Hoffmann. I'm a senior compliance manager at BerryDunn. I am very pleased to be joined by my colleagues today, Senior Consultant Dr. Tricia Lee and Manager Natalie Laaman. The title of our podcast is, What is an IRO? This podcast will be of particular interest to healthcare administrators who are unfamiliar with the process for resolving the obligations associated with a Corporate Integrity Agreement, or CIA, and with the role of an independent review organization, or IRO. Yes, we talk in a lot of acronyms. But before we get into our discussion, a quick disclaimer. The content we discuss in this podcast is based on our professional experience advising healthcare providers, facilities, and other organizations that engage BerryDunn for compliance and other services. While we may reference specific government programs, Medicare and Medicaid policies, and regulatory guidance, we do not speak for any government agency or contractor, nor do we have the authority to do so. Nothing in this podcast should be considered legal advice. Anyone seeking legal advice on the subjects we discuss should consult their own attorney. So now I'd like to start to engage with my colleagues. Natalie, thank you. You recommended this topic for us for a podcast. Can you give our listeners a brief description of what a Corporate Integrity Agreement, or CIA, is, and what are some of the common elements of a CIA?
Hi, Robyn. Thanks so much for having me. A Corporate Integrity Agreement, or a CIA, is a document that plans out the requirements of a healthcare provider or entity that agrees to as part of a civil settlement. The provider basically agrees to the CIA instead of being excluded from participation in Medicare, Medicaid, or other federal healthcare programs. CIAs have common elements, but each one is tailored to address specific facts of the case and may incorporate elements of their pre-existing compliance program. A comprehensive CIA typically lasts 5 years and includes things such as designating a compliance officer, developing standard policies and procedures, implementing employee training programs, and retaining an independent review organization to conduct annual reviews, as well as other compliance program elements.
Thanks, Natalie. Tricia, can you give our listeners a high-level description of the qualifications that are required for an independent review organization?
Yeah, so one of the key features of an IRO is their independence. They shouldn't have any conflict of interest and be able to perform a review or audit really objectively. Additionally, the staff performing the review should have credentials and expertise in the area. So at BerryDunn, for instance, we have physicians, pharmacists, nurses, coders, auditors, clinical documentation specialists performing these types of reviews.
Excellent. Thanks so much. So Natalie, I think sometimes there's some confusion over who is responsible for selecting an independent review organization. Is it the healthcare entity that is falling under the rules of a Corporate Integrity Agreement, or is it the Office of the Inspector General who selects the IRO? And how quickly does a decision like this need to be made?
Thanks. So it's up to the provider to determine who they feel is the best and most appropriate IRO. And that could be an accounting firm, a law firm, or consultant who will engage as the IRO. Most CIAs include language that gives that OIG an opportunity to let that provider know that if its choice of IRO is unacceptable within that 30 days after the OIG receives written notice of the identification of the IRO. Each CIA is different, and it describes the time frame for which that provider must select their IRO, but it's typically within 60 and 90 days of the implementation of it.
Yeah, wow, that can go really, really fast. Absolutely. Yeah, Tricia, I'm wondering, can you talk a little bit about the usual claims review requirements that are included in a Corporate Integrity Agreement, and how long does that claim review process usually take?
Yeah, so they can vary depending on the CIA. Some reviews are done annually, some are quarterly. We usually are selecting anywhere from 30 to 150 claims. Some can include Medicare and Medicaid, some just one or another. In addition to the claims review, there are also CIAs that require focus arrangement reviews. So for example, an organization that may have gotten in trouble for referrals or kickbacks. So we'll be looking at, transactions that took place within that review period, ensuring that the organization followed policies and procedures and that payments received were within fair market value. All the CIAs I've worked on have been for a period of either 3 or 5 years, and the CIA Appendix B really outlines the requirements. So as an IRO, we're really just following along those guidelines written and listed there.
Excellent. Thank you. Natalie, both you and Tricia work very closely on IRO engagements for BerryDunn, and I'm wondering if you could talk a little bit about what are some of the types of, how do you determine the paid claims that would be included in the population for a CIA engagement? So could you share some of that with our listeners?
Sure. So as Tricia just said, everything is outlined in the Appendix B of the CIA. And it really depends on what the OIGs wants the IRO to look at. So for example, as Tricia said, sometimes it's Medicare paid claims only, sometimes it's Medicaid, sometimes it's both. And then the type of service also depends on the CIA. The most recent that we have looked at is the entire universe of claims is eligible as long as it's paid to be reviewed during that review period.
Excellent. And Tricia, I know you do a lot of work in terms of helping to select a statistically valid sample of claims. Can you talk a little bit about the process that you use when that work is being undertaken?
Yeah, so just to kind of piggyback off what Natalie was saying too, sometimes the IRO can actually recommend certain populations be looked at. So let's say the CIA says they want to look at 3 specific locations per review cycle. We might look at the population, the types of service, the total reimbursements, and then provide maybe a recommendation. The OIG monitor can say yes or no, depending on what that is. But in terms of pulling the sample itself, we use the OIG's software application called RATstats. And so that will just pull a randomized selection and spares, and then we can, pull the claim data from there.
Excellent. Thank you. So as we're wrapping up our conversation today, I would like to invite both Tricia and Natalie to share with our listeners what are some of the questions that they would recommend that a healthcare entity that has just had a CIA imposed, what are some of the questions that they should ask as they are going about choosing an independent review organization? Natalie, maybe if you'd like to start?
Sure. I think I would recommend making sure the IRO has the credentials and expertise in the service that you provide, so they understand exactly what you're providing, what should be documented, to make sure that everything is accurate. And as well as I would hope that you build a good relationship with your IRO, because you are going to be working with them for years. So it's helpful to build a good relationship.
Any other tips, Tricia, that you would like to add or maybe expound on what Natalie has offered?
Sure. I think it's really important to remember that a CIA is kind of middle of the road in terms of risk spectrum, with exclusion kind of being at that high end and self-disclosure being at the lower end. It's really important not to panic. Yes, it's a very serious situation and often associated with like a high financial penalty. However, you haven't been excluded, so now it's time to get into swift corrective action here. Really getting organized, read the CIA in detail, including the timelines. Natalie said before, you usually have 60 days roughly to pick your IRO, designate a compliance officer, provide staff retraining, provide a compliance documentation to the OIG monitor. So really just making sure that you know exactly what you need to be doing. Again, feeling comfortable with your IRO. We do a lot of check-ins with our clients, especially ahead of that first review. There's a lot of uncertainty during that time period. So whoever you're working with, making sure that you understand kind of that initial pre-planning phase and how the meetings are going to go. Walk them through the CIA Appendix B, have dialogue about, what is going to be expected for each review. And we usually do, a pre-planning kickoff meeting 3 to 6 months prior to that first review, which I think is really helpful. And so, yeah, I think it's just really making sure your IRO is going to be working with you.
Excellent. Thank you so much. I really, again, would really like to thank both Tricia and Natalie for their time today. We've reached the conclusion of our discussion about what is an IRO. And I would like to add that when visiting BerryDunn's website to access this podcast, our listeners may obtain PDF copies of 2 documents from the Office of the Inspector General, which I think will be really, really helpful to our listeners. The first is a relatively new document. It is from the OIG. It's their General Compliance Program Guidance, which was issued in November of 2023. And the second document is somewhat older, but it's still a classic. It's from August of 2016, and it is Guidance on IRO Independence and Objectivity. Again, we thank you for listening to this episode of BerryDunn's Healthcare Insights Compliance plus Ethics equals Integrity podcast. We welcome listener questions and feedback about the ideas we discussed in this episode, and we would love to get your suggestions for topics we should consider for future episodes. Many thanks.